I got interested in medicine when I was a member of a college basketball team and spent some time with my team physician during the summer. So I would do some research for him and kind of trail around and watch him deal with athletes and patients, and that's what got my interest sparked. As a former athlete, I was used to trying to hone a skill and to dealing with an athletic population. So orthopedics was alluring because it is somewhat physical, it involves surgery, which is technical, it involves skills that you can hone and master over time. And it also allows me to interact with athletes on a regular basis and people who are interested in being active. My typical patients would be anything from a 7 or 8-year-old youngster that's recently had an injury or something that's getting sore, all the way through somebody in their 70s or 80s. I think it's really important to try to get to know the patient and get to know exactly what their concerns are. We have patients that drive from a long way. We also have a lot of patients from our local community, so I like to know where they're from. And really, what's the main issue? Are they trying to get back into something, or is this a nagging issue? They just want to make sure it's okay and they're not hurting anything. The really nice thing about the University of Iowa and working here is we do see a lot of just very different problems than what you see every day run-of-the-mill, maybe in other places. So what brings me to work is to just figure out what we're going to see today and how we might be able to help figure that out. I enjoy working with residents and fellows and students who bring a lot of questions and bring a lot of energy. We certainly feel like we can make a difference. At the end of the day, I often say that was a good day because this patient's going to be better and they have a really good chance of getting back to what they were doing before they got injured or before they came back to see us.